Good morning, team. Thank you for joining me for this month's education series. We're covering something a little different than normal today. We're going to talk about mold. In our clinic recently, we've had a number of cases related to mold exposures in the home or workplace, and I think it's time to do a little bit of update. So we are ensuring we're asking some more environmental questions as we talk with our patients. So just a quick review of what we're covering today, a little bit about our symptoms in susceptible populations. Don't worry, we will not do a quiz on the common molds in Washington State, but a little information of what we typically see. And then testing, inquiry, and treatment and prevention are really a little bit different than what we normally cover here. So we'll talk a little bit about that. And most importantly, we have some patient resources. And then for those of you who like to read more, we have interesting case studies available for you. So one of the challenges we face with mold exposure is the symptoms present as something that is pretty common across multiple conditions. What I would ask that we look for here is, are these unexplained? Are there any other factors? And it's super important we talk to the patient about their home or work environment. So respiratory issues are common. It's also common in multiple other conditions, but are they unexplained? Are we seeing wheezing and difficulty breathing, shortness of breath that has never occurred for these patients in the past? Unexplained skin reactions, unexplained allergy reactions that have not been there in the past and don't seem to be chronic for the patient. Headaches, persistent fatigue, these are the things that might lead you to ask more questions about the patient's environment. There are some cases that are much more severe, and particularly neurological. Those tend to be rare. We have not seen those coming into our clinic. As with any of these environmental factors, we know that some of our patients that are immunocompromised or have some chronic conditions, particularly those related to respiratory, are the most susceptible. And we really want to dig in if we are seeing these. Again, we have seen a number of these cases in our clinic recently. Again, I'm not giving a quiz on this, but it is important to understand that there are varying different types of mold. Black mold is the one we talk about most frequently. A lot of them are caused by similar factors, not all, but things such as water damage can be a big factor, and that's why the home environment review is so important. We don't do clinical testing as our primary we don't jump to that primarily. We really want to start by understanding things that are happening in the patient's environment. Do we have unexplained odors? Is the patient not experiencing this when they are away from that primary environment? We can absolutely do allergen testing, and if we think it's one of many different possible causes, that's definitely a path to take. But let's first start to see if we can understand and eliminate some of the factors that could decrease our clinical intervention and improve their outcomes. The typical treatment here, unless this is serious and unless we're talking about when our immunocompromised patients, we really want to focus on prevention and remediation. The other treatments we might recommend are really just to help with symptoms, or in the more severe cases, we may add an asthma inhaler as we're trying to understand if environment is the primary cause, but otherwise common over-the-counter medications are where we'll focus. We've included a lot of resources here. I want you to know that you can get these flyers at the front desk or add a dot phrase in Epic, and all of this will be available to the patient both immediately and when they go back to their chart in the future. Oftentimes, this is a financial challenge for our patients, and we want them to understand that there are resources out there. If we could prescribe a new housing environment for them, we would, but we know this is complex. So talking to them about the resources is key. Setting up follow-ups as well is important. So here I have included a number of additional resources, and I'd be happy to take questions as you all grab your sandwiches for lunch, and we can talk about this further. Thank you so much.